Hello and welcome to this week's edition of We Care Wednesday. My name is Ryan. I'm a pharmacy student at the University of South Carolina, and this month I'm on rotation at Hawthorne Pharmacy. As we're coming to the end of February and the end of American Heart Month, I wanted to talk to you today about heart attack. First, I'll talk to you about the signs and symptoms of a heart attack, and then we'll discuss what to do in the case of a heart attack. So you may have heard of the hallmark symptoms of a heart attack being chest pain. It's often described as a crushing pain on the chest. It might also be described as radiating to the arm. Usually it's the left arm, but the pain from a heart attack can actually radiate anywhere in the upper body. Sometimes it's described as going to the shoulders or to the back or to the jaw is another very common place. Heart attacks don't always come with pain. Sometimes they do and sometimes they don't. They usually are accompanied by several symptoms, but they can present with as many or as few of these symptoms, depending on the person. So other ways to recognize a heart attack are with if you're experiencing unexplained fatigue, sweating, shortness of breath. For women especially, they might experience nausea or vomiting. So any of these symptoms could be a sign of a heart attack, and if you can't explain this symptom, it's always good to go ahead and get checked out just to rule it out. Another way to differentiate between a heart attack and maybe another cause is that heart attacks, usually the symptoms don't get better with rest. So if you're able to rest for several minutes and the pain or the symptoms don't get any better, always make sure to get checked out by a healthcare provider. So what should you do if you're ever feeling these symptoms and think you might be having a heart attack? The best treatment for a heart attack is getting seen very early. We would much rather treat it early in the course than too late before some of the cardiac tissue has died. So always call 911. The ambulance is equipped to treat you before you even get to the hospital. They usually have aspirin on hand, which is the first treatment for a heart attack is to chew several aspirin. They also have EKG monitors, and they can diagnose the heart attack before you get to the hospital, and that can direct some of the treatment that will happen there and speed up the process. Another sort of way to tell about a heart attack for people that have what's called stable angina, and that's just chest pain, is with nitroglycerin. So if you have ever experienced angina, you may have been prescribed nitroglycerin tablets, and so I wanted to talk to you about how to use those if you do have those prescriptions. So when you're using nitroglycerin, usually it's a sublingual tablet. What you'll do first is put that tablet under your tongue and let it dissolve. You'll sit down for 5 minutes and rest and see if those symptoms go away. If those symptoms don't go away, you'll take one more of those tablets. And then if the symptoms persist beyond that, you will call 911 immediately. That way that they can come see you and check you out and see if you are in fact having a heart attack. Hopefully this video has been informative. Hopefully you'll never have to use this information, but in the event that you or someone you know is having a heart attack, it's always best to be prepared and know what to look out for and what to do in the case of a heart attack. Thank you again for joining us. We hope to see you next week on We Care Wednesday and hope you have a great day.